Well, Kim, over the past 2 days, we've talked about the importance of catching prostate cancer early. But once it's found, what can be done to stop the spread of the disease? Luckily for patients, they have many options to choose from. No one treatment option has been proven more effective than the rest. Ultimately, the decision lies in the hands of the patient. Historically, open surgery has been used most often. Dr. Thomas Colmorgan performs traditional open surgeries. He says the skill of the surgeon is the main factor in the success of an operation.
The goal is to define and find that cancer before it has spread, before it has metastasized, and if so, then I think surgery is a real option and has shown good long-term cure rates in the order of approximately 85% at 10 years.
A newer form of treatment is like open surgery. The difference is robotics are used to aid the surgeon. Dr. David DeMarco says we're lucky to have the option of robotic surgery at McKenzie-Willamette Hospital. He says it's a practice that's been in place for the past 10 years.
I'm in charge, meaning any movement that I make is mimicked by the robotic arm, and so it doesn't do anything on its own. It's not an Autobot.
There are also less invasive procedures. One is performed by Dr. Douglas Hoff. He uses cryotherapy to freeze away the prostate cancer. It's a much newer treatment compared to surgery or radiation.
We usually use about 8 needles, and all the separate little ice balls coalesce into one large ice ball, which then kills the prostate tissue as well as kills the prostate cancer.
Radiation is a common form of treatment for cancer that comes back after surgery is performed, but it can also be used as a first option. The process is easier than you might think. Patients lay on the table for 10 to 12 minutes for 8 to 9 weeks with few side effects and almost no pain.
Again, it doesn't hurt. It's just like getting a chest x-ray. You're not going to feel anything. And the machine would rotate around the gentleman in the form of, this is called a gantry, so different gantry positions, usually 7 or 9 different positions.
The good news is that the success of all these procedures is almost 90%, as long as the prostate cancer is detected early. And prostate cancer is slow moving, which means if you are diagnosed, you usually have some time to weigh those different treatment options. Live in studio, I'm Bryce Onslinger, KEZI 9 News.